As we head into the new year, a lot of us are starting to think about getting back into shape. There's new research about how exercise may help fighting some of the effects of aging. And here to explain more is Dr. Mandira Mehra from SSM Health. Good morning. Thanks for joining us.
Good morning.
So what do we need to know?
Isn't this our favorite topic?
Oh my gosh.
First we talk about the holidays, and then we talk about getting back in shape and how to make us feel better. Right?
Every year.
And we also always talk about the fountain of youth, right? How to ward off things like stroke, hypertension, diabetes, dementia, maybe cancers. Maybe we have part of the answer. Aging is a pretty enigmatic process. We don't really know why this happens, how it happens. There's many theories, and we know that something happens on a cellular level. This is an amazing study that tells us and showed us that they looked at different age category men, young athletes, elderly athletes, and elderly men that just were inactive, sedentary lifestyles. And they basically studied on a cellular level their muscles, how they reacted to exercise, and then acute exercise. The long story short here is that people that were the most active, even the elderly active adults that exercised regularly, had less muscle inflammation. And what that means is we've thought for a long time now that increased inflammation may be related or associated with aging. And so the moral of the story here is if you don't use it, you lose it. And so it's never too late to start exercising, but what the study shows us is the people that have consistently been very active continue to do better and continue to have less of that inflammation. So maybe we're cracking the code here on a little bit of how to get that fountain of youth. Now, we do want to remind people that if you've been very sedentary for a long time or you have different types of health ailments, definitely checking with your doctor, with your healthcare provider, saying, how should I begin this process? We definitely don't want to increase falls risk or make you do anything super strenuous that's going to hurt you, but it's never too late. And if you're already active, the key here is to continue to be active. Again, warding off those other disease processes is very important. People say, well, Dr. Mehra, keeping the body young is fine. What is this doing for my mind? All the studies have shown the more active we are, the better the mind processes, maybe the better it wards off, again, things like dementia, some of these other issues. So being active is not just good for the mind, but also the body. It decreases those inflammatory markers, and then when you do build up those markers, it gets rid of them quicker if you're just used to exercising. What's your favorite form of exercising?
Yoga is definitely my favorite. Okay. And it doesn't take a lot either.
It doesn't. A lot of people get shy. They say, wow, yoga, I have to be in this hot room and it's intense. There are so many different types of yoga. There's even chair yoga out there for people that maybe aren't ready to do the down dog and the intense stuff. So even chair yoga and doing stuff, that's at your speed is a great idea.
Yeah, that's always like what I always say is like it only takes a little bit of something, even just a couple of minutes, and you can feel a lot better.
It's true, and I think people shy away because they say, wow, 150 minutes a week, how am I going to find the time for that? What that breaks down to is maybe 20 to 30 minutes a day. You can do yoga, cycling, biking. It doesn't even have to be a traditional exercise. Maybe it's gardening. Maybe it's tossing a ball with your son or grandson. You know, there's definitely creative ways to get your heart rate up and still stay active.
Yeah, and if you start kind of small, too, you're not going to feel like a complete failure either if it doesn't happen.
And your muscles will get that time to recover, and you're really just gradually working back into it.
All right, Dr. Mehra, as always, thanks for joining us.
Great to be here.
And we'll be right back.